Hi, Dr. Anshu. Can you hear
Hello.
me?
Yes, sir. Good evening, sir.
Very good evening. So congratulations, Dr. Anshu, for
Thank you, sir.
crossing the line and being on that side of the line. I think it's
Yes,
very
sir.
long journey and all. Okay, let's start the session, Anshu. Yeah.
Sir, as you said, to introduce myself. So my name is Dr. Anshu Priya, and I have done my graduation from AIMS Patna. And then I also did my junior residency at AIMS Patna. And during this COVID period, I was on and off, working and preparing, sort of mixing and matching both of these things.
Yeah.
And this was precisely my third attempt. And to be specific, I would say honestly, given second attempt, first was with my college, so that was quite underprepared, I suppose. But this was my second attempt, and I was not able to qualify prelims in my, of course, the earlier two attempts. So this was my first mains and first interview, and I reached onto this stage.
That's great. So, and next thing is your AIMS partner batch is
2013.
2013 batch. Okay, and after internship, you took a break. You're doing your junior residency at the same time you're preparing for the prelims.
So I started preparing only after the residency got over in 2019 September, I suppose.
Yeah. Well, I'll ask few questions here because there's always a dilemma for medical students when to start preparing for IAS and IPS. Because last year, right, the two rankers, Dr. Srija and Akshita, they were doing their internship, and it was a miracle because just after passing internship, they got into this now. So there was shift in the paradigm. People are thinking that they should start at third year, second year, and all. And now there is again a shift because now it was very tough for first timers this year. I think there's more people with second and third attempts. On an average, I think number 3 attempt is an average attempt for all the 600. Whatever the trend I observed this time.
Yes, of course, right.
So there's nothing called ideal when to start, but again, like when, because being doctor itself is a honor in this country, right? So, and there was always there's so many questions in the interview that are you wasting a seat? Like India need more doctors than civil servants and all. So what was your what was the thing that changed your mind to shift your career from medicine into UPSC? What was that catalyst? Yeah.
So, sir, I would say that it was during my second or third year of MBBS, to be precise enough. So that was a time when I also got elected as the vice president of my college. And I got to know about administration. I come from a newer AIMS, and at that point of time, there were many issues with the AIMS that were coming up. So I, as the head of that council, we did a lot of administrative work at that point of time, like arranging hostel for the girls or parking areas, bringing some shops. And at that point of time, I also got to talk with certain officials of this Pradhan Mantri Swasth Seva Yojana. The secretary level officers as a delegation, not just me, we as a student delegation. So I think that was one time when you actually realize that there are issues in even in health sector that require administration to be very proactive. So I think that was my first assessment with the administration as such. And apart from that, while we go to rural postings, especially in cases of CFM, and then at the very grassroots level, you see that people of cervical cancer, which is so preventable, they are in third stage, fourth stage, or people with breast cancer, fungating masses, just because they do not have that kind of awareness, or we don't have that doorstep delivery of preventive healthcare, which also has some administrative facet to it, because of which people suffer. So I think precisely these two events combined together. And of course, I shall also say that I had a lot of interest in humanities subject in polity, economy. So I thought that all these factors combined would be a better way to start with this preparation.
Okay. Anything like that Bihar has influenced you because you're from Bihar, right? I know many of the doctors are part of UPSC MEDICO now from Bihar. Bihar, Gujarat, Rajasthan, because I'm from South, I'm from Hyderabad.
Yeah, of course, I know.
There's not much trend in here, let me tell you. People are more fond of software here because we have all the Silicon
Yes.
Valleys in the south, and people are more fond of doing MDDM and all. But what I see is from these states, what I just spoke, there's so much of passion to become civil servants, even from the doctors fraternity. Maybe uh, I can't say that that is definitive influence, but Bihar is IAS for me. Like whatever I observe, there's so many students, aspirants from Bihar who are cracking it time and time again for long now, right? So,
Quite okay, sir.
so we're discussing answer writing strategy. So you're saying that practice makes a man perfect, right?
Yes.
That was the thing you're doing. Like similarity between you and Dr. P. Srija last year is even with optional, you have finished the subject-wise part of the optional long back, like maybe during the
Yes.
main preparation. That was very important, and
Yes.
that was what I tell all my students again and again, that don't push it till the last, because between the mains, between the prelims and the mains, that 100 days, they're very crucial. That's the time to revise. That's not the time to practice. This is what I tell students. But again, it's not easy. It's
Of
not
course,
easy.
I remember that whatever copies like you had checked and given me, I had done it, I think June 2020.
Yes, yes.
June,
No
July
problem.
2020, I had completed. So you had given me checked papers, written comments, and given me answers also. You
Yes,
just mailed to us. So I used to revise those answers.
yes, yes.
I think that is
So
precisely what I did, because the medical science is also very huge to revise the entire syllabus in between prelims and mains. But your questions are mostly based on past years.
yes, yes.
So I used to revise your answers and then whatever feedback you had given. So that was quite helpful, I think, because I had finished it, and you had a very elaborate feedback also, because that I think you could not have provided me between that time of prelims and mains, because you were also quite occupied
Yes,
at
yes,
that point of
yes,
time. So I think that your feedbacks were very helpful in that regard.
yes. See again, the problem here is, I'll tell you. We have 100 days. We have 300 students. We
Yes.
have 3,000 papers.
Yes, that is what, sir.
Right.
Yeah.
It becomes
Yes.
very tough at this part, but again, we'll try to match it up. But if you do it early, na, that is always an advantage in this exam.
Advantage.
Okay.
So that is what.
And the second thing is, like test series, keeping it in a PYQ centric fashion. See, that's what I always tell my our junior doctors, that don't try for sense of completion. You're not going to become a doctor here. If it
Yes.
is for PG exam, if I don't teach you the extra points, I'm doing harm to you. But if it is for UPSC, if I'm teaching any extra point, I am actually doing harm to you. The reason is you don't need any additional thing. It's a repeat paper. If you analyze it, see, that's what I do as my job. When I look at paper every year for the last 4 5 years, I'm in this, like in the medical science part. They're keeping it very simple. Only thing is you need that content to revise, that concised content in the last, so that you
Yes.
can just prepare, revise, and go and write it there. Because for these medical science optional is not one subject optional. It's not like history, or it's not like geography.
Yes.
It's
Yes.
a
I
mix of 11 subjects, right?
understand.
So you should have that boundary. That's what is very important, and that's what I admire, that you have finished it. We were talking like maybe in the June 2020. I think we had a long conversation
Yes,
about
sir, that is
each
what I was
paper.
saying. That
Yeah.
you had
Yes.
talked to me for 2 hours something,
Yes.
and gave me such elaborate feedback on every question. Like
Yes.
this is how you need to write, and I just noted it in my diary. It was 3 pages notes. Whatever you had told me, I had noted. So
Yes.
between my prelims and mains, I always used to look at it.
Yes.
Apart from that, I don't think I have done anything major in medical science. Like I have given it, and I do admit it that I have given it lesser time as compared to what I gave to GS, essay, and interview, maybe. But sir, I think that was quite helpful, because
See,
if somebody.
this is very important point you're coming up with, because not only, so last year anthro was a bouncer.
Yes,
Anthropology, like people who were preparing for anthropology, they were thrown out. People with medical science, for example, you take Srija and Akshita, they got 300 plus and they are in top 50.
yes,
See, this is unpredictable from optional point of view. Not only anthro medical science,
yes,
any optional is unpredictable. So you have to, for all the doctors, I want to tell one thing here. Optional, yes, it's crucial, but deciding factor is always your mains answer writing and your interview performance. And interview performance can't be done in 1 month or 2 months. It's your personality. For example, you take Dr. Anshu. She was like a proactive person since her third MBBS. Like she was participating in some activities. I can't say that you should be a social activist here, but you should have that insights, that administrative insights. Like if they ask you a question, like what is your role, what will you do in this particular situation? So you need to own that common sense. It's not about language, it's not about communication skills, it's not about your background or whether you're from IIT or AIMS Patna. These are all secondary. The primary thing is you as a personality. Are you equipped enough with all the qualities you need to become a civil servant, like the prestigious and esteemed position, right? So they can't be done in a 1 month. See, I was doing interview guidance program, right? I was sharing a lot of medical content updates, NFHS survey and all. This year I started because since last year people were asking me. I'm being very frank because I'm a clinician. I don't know how these things are done. I'm learning with all of you. I'm
Yes,
also
sir.
learning a lot of things all of with you. So this time I realized that it's so for the next batch, what I'm going to do is not for 2 months. Every month, I'm going to come up with that current updated content so that it should help them in a proper way, right?
Yes.
So interview is the deciding factor. That's what you proved. Like it's something else. Like yes,
Yes,
you
sir.
did very well in mains, but interview is also a deciding factor. So with optional, every year one optional is thrown as a bouncer. This is what I observed in last 4 years. Last time Anthro was like nightmare paper. That's what students told me. And I can tell you 70 students shifted from anthro to medical science
Oh,
in the last
okay.
one by
Okay,
looking at
sir.
that paper. So keep your basics tight. Okay. Just that paperwork stuff, you can't just prepare everything. You have to prepare only that stuff which you can revise in the last part of the exam. I
Yes,
think
yes.
that is what is very important. So
And I
as we're
also,
discussing, yeah, go
yes,
ahead. Go
yes,
ahead.
sir, yes. So you wanted to ask something?
Yeah, so we're discussing the optional part, the role our UPSC Medico test series played in shaping your answers and all. And let's also discuss optional strategy because there's so many doctors who will be watching this video, the future doctors. Let me
Yes.
tell you now the trend is changing. This year I got almost 100 plus calls who are starting from third MBBS. They
Okay.
think that the ideal time is third MBBS. I tell them, yes, it's too early. I'll tell them two reasons. One thing is, if you want to start now, focus on your theory exams. Second thing is theory, the board theory exams, because mostly you will be writing the same questions.
Writing
Right?
the same
Second
questions.
thing is, if they want to ask me about the GS and current affairs, I was telling them try to finish your NCRT and the static portion, ethics and all, because if you want to have 3 4 years of current affair knowledge in your brain, now that will only burden your Gaira and Salke, right? I think
Yes.
it's ideal to have 18 months or 12 to 18 months of current affair knowledge is more than enough because they limit themselves to that portion of the syllabus, right? So, what advice you want to give to third MBBS students who are starting now, and what advice you want to give to doctors like you who start after intensive? So, just
Yes, sir.
divide it and tell me, yeah.
Sir, I think you answered the first part very nicely. And I think you have said this to us also quite a lot of times earlier. And as I said, see, third year, whenever you are in second year, third year, perhaps I am not sure whether we have that insight. Nowadays, as sir is saying, people might
Mental
be
stage,
thinking
yes,
to
yes.
doing in first and second year. But I think just after clearing MBBS, everybody wants to enjoy that medical life and learn something. At least that was the trend in my time. But even then, if you have thought also, as I said, please focus on your theory and board exams. Please do not focus on anything else at in second or third year of your MBBS. I tell you this from my own experience. As I said, I had done well in my MBBS and I had read all my books very thoroughly. So in the last 2 years that I have prepared, I don't think I have given more than 4 or 5 months to medical science optional. I say this, and I would also, I was saying this earlier also. If you have any source, like sir gives notes of all the topics combined, I think, sir, you have
Yes, yes,
a video course also,
yes,
and
yes.
then you also have notes. Now, I was quite late. I think in 2019 when I started, I did not know about you because I think you had started
Combo
then
started in 2020. 2020.
2020. So
Yes.
I did not know about any such institute. So I had to toil a lot for 4 months to prepare notes by myself.
Yes.
But I think if somebody else, like you are giving notes to people syllabus wide segregated, that is very good. Because the medical science is not like a political science paper where you will have to collect data from this source, figure from this source. You cannot write anything extra in thyroid cancer that you will be providing.
Yes, yes.
The
That's very
content is
important.
same.
Yes,
it is
yes.
it is not something that anybody else can extra put. What is fact. It is 2 plus 2 is equal to 4. So if you have any source like sir is also providing where you get consolidated material at one place, you please follow that and revise it at least whatever number of times you can. If you do this, you will do very well in your medical science optional.
Yes.
At least you will get more than 260, 270, or in fact, whatever I got, 260K close mein. So you will do that. So that I wanted to tell for that. That is why in first and second year, in my third and fourth year, please focus on your board and theory exams and your textbooks. And if you want to prepare for UPSC, you take the guidance of any such coaching. For example, sir is also there, and just try to figure out what UPSC is asking. Have your notes at one place, and preferably don't try to make them by yourself, especially medical science, because it will consume a
Time
lot
taking,
of.
time taking process.
It is
Yes.
very time taking process, and it's sir, it's very easy to understand. For example, breast cancer notes, even if I make or you give me, the matter remains the same. I mean, there is nothing extra that I will be putting on it. So you, I think third, fourth year तक तो आपको इतना करना चाहिए. अगर आपने इतना कर लिया तो आपका ऑप्शनल हो गया, है ना? तो फिर आपको सिर्फ रिवाइज करना है और आपको जीएस की प्रिपरेशन, यू हैव टू प्रिपेयर फॉर जीएस.
When to
People who,
start GS part, just tell them that, because
I think GS part, if somebody wants to give in the internship this examination, as Dr. Akshita ma'am also gave last year. So for that, I think, so then you have to start early. She started in
third in this.
year,
Yes.
I think. Yes. So if you are so determined to give it like ma'am did in internship, you can start from third year. It will take you 1.5 years to understand the nuances of these humanities subjects. So maybe, but if you are somebody like me, for example, I had done very hard work in my MBBS, I believe. So I wanted this internship period कि मैं कुछ सीखूं. I should go to the hospital, to the ward, and learn something like how to do injections, suture कैसे करते हैं. I just wanted to learn all those things. So at उस year, I did not think of giving this exam. And that is why I had planned I'll go and prepare for 1 year and then give. I think Dr. Shrija ma'am also did the same thing.
Same
She
thing.
also took 1 year break, and then she prepared and she appeared in her first attempt. She got 19th or 20th rank. Ma'am got. So
Yes.
ma'am was like,
Okay.
yes. So that is what I thought. Internship may I will learn, then I'll go and prepare. And my optional was I was well with my optional even in my MBBS period. So when I came, I just kept on revising. I have revised at least twice or thrice my optional, whatever I had prepared. And notes, as I said, I did not know about any coaching or about sir at that point of time. So it was initially I prepared it all by myself. I revised. I joined your test series. I wrote all the tests, I think.
Yes, yes.
Whatever
Completed all
test
the
you had,
tests. Yes.
completed all the tests. I took sir's feedback, I made a 3 or 4 page notes of whatever tricks you had given me. Don't cross the margin, write like this, don't do this. In every paper wise, I had written microbiology में मुझे ये गलती नहीं करनी है. So that was very much in my mind. And then rest of the time went in GS and SA and then interview preparation as well. So I think, sir, overall, it's an accumulation of everything. You do good in GS, then you do good in optionals, a little bit also, 250, 60, whatever is the average score, and you do good in interview, it comes out as a good result at the end of the day.
So that's what they say, right? This exam, it's a marathon. It's not
Yes.
like a medical PG exam.
Yes, sir.
When you're starting, doesn't matter here. Like with what attitude, with what determination you're starting. That's what, because Akshita has set up an example that you can do it during your internship, and you and Dr. P. Srija rank 20 and rank 16. It can be done even after enjoying your medical stuff, right? That internship is the phase where we enjoy and we treat patients. So you're done justice to your part. Again, like as a doctor, you did do service. I have seen your mock interviews also, wherein you're saying that you are a part of your state's telemedicine.
Yes, sir. I was a part of it, and we educated a lot of people. We had clinics. So I was interested in my own profession also a lot. So I used to pursue that as well.
Yeah, yeah. That's what they say. During bachelorship, why we are given this doctor badge? Because we are teachers too, right? We have to teach that. We have to teach that prevention is better than cure to all the patients. I think for young budding doctors, they should develop that. When you're starting, doesn't matter. But when you start it, make sure that you're not spending so much of time in. You're not running a coaching institute, or you're not a teacher to prepare something like Bibles and Gitas, right? When you have a good source available, make use of it like a catalyst, because your hard work is the primary thing which decides the fate, not my coaching material or the videos, right? They're only they works like a catalyst. So when you use these resources, I think it is becoming very easy. Just 1 hour back, I spoke to one student for the last 2 years. He was giving his attempts on his own. He's only stuck at preparing his own notes. The problem with medical science is, though it's static, I'll tell you, your answers become outdated. If you
Yes.
don't join the fresh stuff, what happens is you might be writing something else for management of myocardial infarction. Every year or every 2 years, American Heart Association is coming up with new guidelines. They say give this dose, give this. So these fine tweakings are the deciding factors, because you think that every year they're asking you what is the lifestyle measures for hypertension, but every year in park, every year in this thing, new studies are coming out. Even vitamin B12 has a role. If you don't write that, if you still stop at quoting salt as your answer, you're stuck. Like this few 4 or 5 students who called me, sir, I wrote very well, I don't know why I didn't get. You wrote very well, but the problem is your content updated? Do you have updated content with all the latest facts? Because when they get a key, the examiners, when they're correcting papers, they have the latest stat. Though it's a static optional, I think you should have that updated knowledge. That's what I do for even model answers. Whenever I come across any new point, new stuff, you are the people who help me. Like you suddenly come up with something current affair related medical science one, which
Yes,
I'm
yes.
very poor at. I'll just take this, I'll put it in the group, I'll put it in the model answer sheet. So that's the reason I don't give printed material, because every day my notes and my model answer sheets, they change with
Change.
each new point. And time and again students are asking me, sir, sell printed notes, we'll pay you anything. I say, no, ab padhna hi nahi. You should never read a printed notes, because if I give a printed notes now, it goes to a Xerox shop. After 5 years, our very own junior doctor will be reading that outdated notes. He'll be wasting 2 to 3 years. You can't take optional as a joke, right? I can earn money by releasing the book, but let me tell you, that's not going to serve a purpose. That's why every year we buy 21st edition, next year we buy 22nd edition, next year doctors do that. They don't read outdated because you're treating a patient. So that's what I tell them. So good. What is the difference between using the coaching or not using the coaching? I'll tell you. If you use a coaching, you have some support, so that whenever you fall, like mentors, coaching institutes and all, their main intention is to help you to reach. I never imagined that a doctor would get into top 10, top 20. It is changing with UPSC MEDICO, and I could see that change. So I'm telling you, because I am also of the same opinion, because when I entered my MD, general medicine, I didn't took any coaching. But I did that mistake because it took me 2 years instead of 1 year. All my friends joined some reputed institute in Delhi. Now I am junior to them. This is the only difference. Otherwise, let me tell you, you can do it on your own. It's only a matter of time.
Yes, sir,
It's
of
only a
course.
matter of time.
Yeah, that is a very valid point that you said. You can prepare entire medical science notes on your own, but it will take you 7 months. Somebody else will give you, and in those 6-7 months, you can revise twice.
You can save GS and all.
Yes, so
That's
that
the
is.
main thing.
But I say this only for this in this examination. I say this only for an optional like medical science,
Yes.
not for GS. You cannot copy the notes of GS and read it as your own. For GS, you will have to make your own notes. But for a topic like medical science, which is static but needs certain updation, I think if you have some notes updated like you are giving, I think that is a good idea. At the hindsight, I think that this is something that I should have done perhaps, but I did not know. And then
Problem is, like, you can't go and look into update journals,
yes,
medical
that is
journals and all. You can't be aware of all the facts which are happening, Harrison, Bailey and all. That's the basic problem.
yes,
Otherwise, I'm a doctor, I'm admitting myself. If you want to do on your own, doctors, go ahead, start early, do it nice. But test series is very important. But if you don't want waste time in collecting resources, and second thing, very important, if you do not have any financial constraints, don't think that doctors are always rich. I was 3 years back, I think I was attending a NEET PG exam just to know how the trend of the paper is. Not in a good situation. It's not pathetic again, but at that point of time, during your internship, during your final year, financially it is very tough. You're already grown up. Parents slowly will stop supporting you. You have to be on your own. You have to wait for your stipend. It is very tough. So unless you have financial constraint, if there is a resource available, you have to go and grab it. Make sure that you're not wasting your time, because each year wasted 1 lakh pool of competition is adding up to that level. So then it becomes very tough for you. Okay. So prelims again, not only you, there are 23 other doctors who didn't clear CSAT. Last time, CSAT was nightmare for all the medical students. Maybe we are not so much into the mathematics and all. I think so. You have what was your MBBS final percentage?
I had 76%.
Yes.
It was the highest in my batch for the entire duration of course. But you don't need to get any such gold medal for cracking this exam. I had that, and that helped me. As I already said, that I did not invest a lot of time in medical science optional while I was preparing for this exam,
Yes.
because I just joined test series and did my basic stuff.
Yes.
And then I prepared for GS. So that helped me maybe. But without getting a gold medal, if you just have command over basic things of medical science, you take certain help maybe if you want, you can very easily do it.
Yes.
What I
So yours is the first or second batch in AIMS partner?
It is second batch.
That was the
2012.
time wherein AIMS was decentralizing,
Yes,
right, from Delhi.
yes,
And
that was the time when newer aims were coming up.
yes, yes. So how is it now? Like in your college?
Now it is very nice, sir. There are almost 10, 11 super specialty departments. AIMS Patna did very well in COVID management also. It was the center of excellence declared by Bihar government. And now I feel very proud to be a part of that institute. So
Why
it
not?
has,
Why not medical PG? Why UPSC? Have you tried for this PG exam and all entrance? Have you?
no, sir, I did not try for. I was quite clear once I decided that I had to do this. And I think, sir, Akshita ma'am also last time we had a session, she said a very good point that both these exams are different. Even
Different,
though
very different.
you may feel that the syllabus is same, like you study the same thing, approach is totally different. I don't think that I have never seen how a PG exam paper looks like. Now, if that is a surprise to many, if if my destiny would not have allowed me to enter into this service, I might have had to look at how that looks. And that is precisely also the reason why I took this optional, because I wanted to keep my doors for post graduation open, so that if I have to go back, maybe I thought of giving 3 serious attempts. So this was my third attempt, uh, second serious attempt. So I would have given one more. If I did not do, then I would have gone for my post graduation. But simultaneously, I think one should not prepare. It's my personal view. Both these exams have very different patterns. The aptitude for questions, the type of questions, the practice that you require are very different. And you will simply complicate if you start preparing for PG. PG is too vast, I think. They are into too much details. This examination is very broad, like your professional or university exams.
Plan B. What is your plan A? You have to decide. If your plan A is medical PG, if your plan B is UPSC, please don't do it. You're out of this. You're out of
Yes,
this
of
because
course. I agree.
UPSC is not just medical science. Medical science only 30% of your UPSC syllabus. Rest of the 70% is your personality, ethics, general studies, current affairs, NCRT, and all these are. So you're not competing with 1 lakh doctors. You're competing with 10 lakh aspirants. So it's altogether a different ballgame. But if your plan A is UPSC, if you prepare for it, if you keep medical science as your optional, let me tell you, we have both UPSC MEDICO and MedCampus. MedCampus is for NEET PG, INSET, USMLE and all. I do content for both the things. Let me tell you the similarity for all the doctors. What I want to tell you is, only these topics are asked there also as a PYQs. I can't promise you that you'll get top rank or top 100 or top 200. You'll definitely get a clinical seat with whatever content we read here, because the same hernia questions they'll ask, the same inguinal anatomy they'll ask. So topics are similar. So it's like topics are repeated, not questions. This is the norm nowadays in an integrated fashion. Even nowadays, medical science paper is also getting integrated with a little bit of current affairs and little bit of vertical subjects, right? So, but this time paper was pretty simple. Yes, yes. So thanks again. Enjoy the moment, because I know, right? It's a marathon. It takes years again. Okay, I'll summarize few points for our all the doctors and all other aspirants. Sorry for taking up this doctor term again and again, because if someone else is watching, let me tell you, we are doctors first, then we are administrators.
Yes, sir, I do
Right?
agree.
So Anshu Priya is always a doctor for me. Then she is an IAS again. So first and foremost, the starting time doesn't matter, but your personality, your grit, your consistency matters here. It's not about when you start for any medical student, for an aspirant. But if you're starting now, make sure that you are planning this journey for long. Like, don't be adamant and ignorant that you're going to do it in 1 year. The sole reason, and so what I did is, when I launched 2020 combo course, I kept it at 2 years, and many students were reluctant to join, thinking that sir itself is asking us to prepare for 2 years.
Yes, so
I was trying to convince them that, bacha, aisa nahi hai. If you can't do it this time, you won't be coming and spending the 20-25K again, right? I know this the nature of the exam. At least at least you're covered for next 1 year, so that you don't have that thing in mind that fear you have to join again, you have to start again. And second thing for keeping it for 2 years is, I myself know that this is going to take 18 months, because the nature of the syllabus and level of competition, this is what is very important. So timing doesn't matter, but when you start start it with consistency and be prepared for long run. And second thing is, for a static optional like medical science, no need to spend a lot of time in making your own notes, but don't do the same mistake for GS, because GS you'll be writing the same question. Only 500 doctors will be writing the same question here, but I think 5,000 or 10,000 will be writing. So unless and until your answer is different, you're not going to get good marks. I think that's what I'm telling most of my students. All the doctors are UPSC medicals now. We have 1,000+ batch now. Now it's not about UPSC versus aspirant. It's about UPSC versus UPSC medical. This is what is happening now. So that's what I tell students. Sir, should I tweak some answers, or should I make some value additions from something else? I'm saying, please do that, Baba, because when they're correcting 500 papers, out of that 400 papers are from my notes. If someone else is giving one different point, he's going to score more than you, because that's not my fault. It's just that even if it is medical science, if you have any practical knowledge, for example, if you're working for COVID, if there is any COVID related question, if you want to add that extra point to that, that will definitely give you. So don't go and now start searching all the journals for extra points. What I'm telling you is, try to link your current affair answers to the medical science. That will work most of the times.
Yes.
Most of the time that will work. So this is third thing. Fourth thing is CSAT, nightmare for medical students. So give some extra. Don't drag it till the last minute for CSAT. Finish it off and revise CSAT also. Though it is a qualifying exam in nature of 33%, it plays a vital role, and I had seen very good intelligent doctors failing to crack it. So CSAT is not a joke again. And again, answer writing test series is vital. That's what Dr. Srija was telling. Kuch mat karo. Don't do anything. First go and join a test series. Start writing, because this is an answer writing exam. This is not option 1, 2, 3, 4. Whatever you read, that's what happens with medical PG coaching institutes. When you go there, the teachers will teach you very nice concepts, but when you go back home and when you try to put your pen on the paper, nothing comes there. They're all key concepts. I think that's what is very important. And interview, yes, 204, I should appreciate you for that. And your total marks are 1022. In the description, I'll share that scorecard, because many students are asking me.
Yes,
that.
sure, sir.
Okay, so I'll give you 1 minute. We'll conclude it. Yeah.
Okay. So I wish all people best, whosoever are writing the prelims exam on 5th of June. And I come from, it is for everybody, whosoever is watching, and especially the doctors. I am from their fraternity. So I wish you all the best. And I think that after the prelims exam, if sir wants, sir permits, then we can have some session on mains, medical science, or how to write answer. So that we can do after the prelims examinations.